how do we know when a expecting mother has true labor pains or not? There are three factors which we should know about true labor pains. First is a bloody discharge, which is called show, which a mother can have at home. And the second thing is contractions. The third is maybe a water break. So let's see about show, a bloody discharge. So why does a mother have show or bloody discharge when a labor starts? That's a mucus plug which is in the cervix. The cervix is the mouth of the uterus. So when the plug falls down, it can be slimy, it can be bloody, a thin pink color or a dark color, and it can also be a little watery. But if you see a lot of blood, then definitely it is not show, it could be something else and you have to rush to the hospital. It could be because of placental separation or any other reasons. If you see only slimy blood discharge, that is okay. The second thing is contractions. What is contractions? The uterus has a musculature. The muscles contract to push the baby down into the pelvis. When it contracts, it has to relax too. So it contracts at regular intervals to push the baby down into the pelvis. So how is the contraction? How can the mother feel a contraction? It starts from the back and goes down all over the waist towards the belly and the lower half of the abdomen. The mother can feel the tightness of the abdomen for a couple of seconds at the beginning, and then it could progress to 30 seconds. So regular contractions, so regular tightness of the abdomen and relaxation at regular intervals with progressive contractions, the mother has to visit the hospital. The third thing is water break. So the water can break even without the starting of labor. So the water can break and then the labor pains or the contractions can start. So please don't wait for the contractions. If you feel a watery discharge, the discharge will be just like water. If it is slimy or something like white discharge, then it would not be a water break. So if it's flowing and if you're not able to hold it, just like urine it might flow, and if it is not smelling and if it is transparent and if it's wetting your underwear and if it's wetting your pad, please come to the hospital and get yourself checked. So these three things, keep it in mind. Bloody discharge, contractions which is continuous and progressive. So people do have pain, that is contractions, around 3 to 4 times in an hour. It has to progress to 3 contractions in 10 minutes for a good labor pain. And the third thing is water breakage. So if there are any signs at home, please come to the hospital and get yourself examined.